The broadcast is now starting. All attendees are in listen-only mode.
Hello everyone, and welcome today to our webinar, our wellness webinar, brought to you by Security Health Plan for our Life Focus program. This is a webinar available to all of our employer groups participating in our Life Focus program, and my name is Angie Pirro, and I'm a health educator with Security Health Plan. Today we are very lucky to have with us Sue Trudeau, who is a nurse practitioner who works specifically with sleep medicine from the Marshfield Clinic. Before we get started and I introduce Sue a little bit more, I would like to cover a few housekeeping items. Please keep in mind that the information provided during today's webinar is designed for educational purposes only. It is not intended to be a substitute for informed medical advice or care, and so you should not use this information to diagnose or treat any health problems or illnesses without first consulting your provider. Also remember to have your speaker's volume on your computer turned up, and if you do have any questions along the way, please feel free to use the questions tab on your control panel. We'd also encourage you to monitor and use the chat feature where we will discuss today's webinar topics. The webinar will be recorded and archived for later viewing, so if you need to step away or you'd like to attend at a later time, please feel free to do so, and that is available through securityhealth.org. Shortly following today's webinar, you will also have the opportunity to provide us with some feedback regarding your thoughts, and we would encourage you to complete that and let us know what you think, or if there are other topics that you'd be interested in learning more about. Lastly, if you are participating today as part of a workplace wellness incentive program, please keep in mind that if you are viewing the presentation as a group, you will need to contact your wellness representative to learn more about how to confirm your attendance. Today's webinar is entitled All About Sleep from A to Z, and we have with us Sue Trudeau, as I mentioned earlier, and Sue has been in the world of sleep medicine for 15 plus years, and so she brings with her a wealth of knowledge regarding sleep, and we were just chatting a little bit earlier about all the details about sleep and how much a detailed and intricate process it really is. And so with that, I'm going to turn it over to Sue, and Sue, if you could share with us a little bit more about your passion for sleep and why it is, where you got started, and then we'll get going from there.
Okay. Well, thank you, Angela. I'm Sue Trudeau, and I have worked in sleep medicine at the Marshfield Clinic for 15 years. My passion for sleep actually started about 13 years prior to that, when I worked as an EEG technician at the clinic, and we opened the Sleep Disorders Center, which was almost 30 years ago. I enjoyed doing sleep medicine by running the sleep studies on patients, and I often found it really interesting, and patients thought that I was kind of unusual that I enjoyed watching people sleep, but it's a very active state, and there's a lot going on and a lot to listen to and to watch. Now I don't run the sleep studies, but I actually order the sleep studies and see people back after the sleep studies for results. What I found over the years is that there are a lot of myths about sleep that my patients share with me. I hear them frequently and may even experience them far too often. Sleep disorders are common. They're easily recognized and often treatable. It's important to identify these myths because the incorrect information can be serious and even dangerous. I've compiled a list of common myths about sleep and the facts that dispel them. The objectives today are to identify some of the myths and facts about sleep, discuss some of the common complaints and disorders, and provide some tips for sleeping smart. The first myth, and one of the more common ones, is sleep is not important, that you can cheat on the amount of sleep you get. The fact is that sleep is vital to our health and our well-being, and it is just as important as food and water. Sleep need is biological and genetically determined. We spend a third of our lives sleeping. We actually sleep about an hour to an hour and a half less than we did 100 years ago. Sleep experts say most adults need between 7 and 9 hours of sleep a night for optimum performance, health, and safety. There is a way that you can determine how much your sleep need is. You should go to bed when you feel tired and get up when you're ready with no alarm clock. The right amount of sleep allows you to wake up refreshed and have optimal alertness and energy throughout the day. When we don't get enough adequate sleep, we accumulate a sleep debt that can be difficult to pay back. If it becomes too big, you start falling asleep unintentionally during the day. The resulting sleep deprivation has been linked to health problems such as obesity and high blood pressure, negative mood and behavior, decreased productivity, and safety issues in the home, on the job, and on the road. The second myth is that during sleep your brain rests. And this is what I talked about earlier, how active nighttime is. The fact is the body rests during sleep. However, the brain remains active and gets recharged and still controls some of the body functions like breathing. When we sleep, we typically drift between two types of sleep. REM sleep, which is rapid eye movement sleep, and non-REM sleep, and these cycle every 90 minutes throughout the night. Non-REM has 3 stages with distinct features. Stage 1 is drowsiness, and you can be easily awakened. And deep sleep, which is stage 3, during which time the awakenings are more difficult and where we get our most refreshing sleep. However, even in the deepest non-REM sleep, our minds can still process information. REM sleep is an active sleep where dreams occur. Breathing and heart rate increases and becomes irregular. Your muscles relax and the eyes move back and forth, thus giving the stage its name, REM sleep. An active brain during sleep prepares us for alertness and peak functioning the next day. One thing that I thought of during this part of the presentation is that I get asked, do I dream every night? And I just want to mention that most everyone dreams every night. It's our ability to remember the dream that doesn't occur, but we do dream every night. The next myth is the older you get, the fewer hours of sleep you need. While sleep patterns change as we age, the amount of sleep we need generally does not. Older people wake up more frequently during the night and actually get less sleep at night, but their sleep need does not change. Because they get less sleep at night, they nap during the day. Planned naps are actually a good routine that can promote wakefulness. Sleep difficulties are not a normal part of aging, although they are far too common. The next myth is sleep disorders are mainly due to emotional or mental problems. Sleep disorders have a variety of causes. Insomnia usually results from a combination of factors. Some of these factors include stress, lifestyle behaviors such as taking stimulants, drinking alcohol, your work hours, and exercise. Insomnia can be affected by environmental factors such as too much noise or light in the bedroom. Physical illnesses such as pain and heartburn can cause insomnia. Psychiatric problems like depression can cause you to sleep less at night or be more sleepy during the day. And then there are other sleep disorders that can cause insomnia. Sleep apnea, which is probably the most common sleep disorder that we see, is usually caused by an obstruction in the airway during sleep. Narcolepsy is characterized by excessive daytime sleepiness and a tendency to sleep at inappropriate times. Although the exact cause is not known, narcolepsy appears to be a disorder in the part of the brain that controls sleep and wakefulness. No one knows yet what causes restless legs, in which an uncomfortable sensation occurs and it's relieved with movement temporarily, but restless legs is an inherited disorder. The next myth is snoring is a common problem, but it isn't harmful. The fact is that although snoring may be harmless for people, it can be a symptom of a life-threatening disorder called sleep apnea. Sleep apnea is characterized by pauses in breathing that prevent airflow in or out of a person's airways at night. The pauses reduce the oxygen level. The oxygen level wakes you up briefly so that you breathe again. The vast majority of people with sleep apnea are unaware of the pauses in breathing, and the awakenings are so brief that they don't store them in their memory. So often the apnea is reported by a partner. Apnea can cause excessive daytime sleepiness. Obesity and a large neck size can contribute to sleep apnea. And sleep apnea can be treated to improve your nighttime sleep and your daytime alertness. The next myth about sleep is insomnia is not a serious sleep disorder and has no consequences. Insomnia is a clinical sleep disorder, and it can be characterized by difficulty falling asleep, waking up too early and not being able to fall back to sleep, frequent awakenings during the night, and being unrefreshed in the morning. Insomnia can be a symptom of another sleep disorder or other medical or mental health conditions and can often be treated. Several consequences of insomnia are increased risk of car crashes. When insomnia symptoms occur more than a few times a week and impact the person's daytime function, the symptoms should be discussed with a healthcare provider. The earlier you treat insomnia, the better it's going to be treated with whatever things you do. The longer insomnia goes on, the harder it is to treat. The next myth is if you wake up in the middle of the night, it is best to lie in bed or toss and turn until you eventually fall back to sleep. Waking up in the middle of the night and not being able to fall back to sleep is insomnia. How this is treated is if you wake up for more than 15 to 20 minutes, you should get out of bed, go into another room, but engage in a quiet, relaxing activity, such as listening to music or reading, and only go back to bed when you're sleepy. And this has to be repeated as often as necessary throughout the night. And it's also best if you avoid watching your alarm clock. The next myth is about teenagers who fall asleep in class and having bad habits and or are lazy. According to sleep experts, teens need at least 8.5 to 9.25 hours of sleep each night, which is more than most adults need. Their internal biological clocks also keep them awake later in the evening, so they have difficulty falling asleep at the regular bedtime and keep them sleeping later in the morning. However, school usually starts early in the morning when the teenager wants to sleep. So the teenager needs more sleep, goes to bed later, and sleeps later in the morning. That results in many teens coming to school too sleepy to learn, though it is not their fault. The next myth is that the human body adjusts to shift work. 15 to 20% of the nation's workforce are shift workers. They're at work when their internal biological clocks tell them it is time to sleep. Sleep-producing hormones such as melatonin are produced at night when shift workers must be fully awake and alert. When it's time for them to sleep, their irregular schedule works against their internal biological clock, and they may find it difficult to get a full 7 to 8 hours of sleep, even though they need the sleep. It is usually much more difficult than people who work the traditional 8 to 5 work schedule. They're at increased risk for excessive daytime sleepiness while they're awake, and also because of the insufficient sleep that they get, they're at higher risk for high blood pressure and heart problems. You may have heard of some of the catastrophes, like the failure of the Space Shuttle Columbia and the crash of the Exxon Valdez, and these have been attributed to human fatigue. The next myth is turning up the radio, opening the window, or turning on the air conditioner are effective ways to stay awake while driving. And I hear this far too often. These aids are ineffective and can be dangerous to the person that is driving drowsy. If you feel tired, the best thing to do is to pull over in a safe area for 15 to 45 minutes and take a nap. Caffeinated beverages can help overcome drowsiness for a short period of time, and it takes about 30 minutes for them to kick in. If you are driving when you're sleepy, you should, or if you drive when you are sleepy, you place yourself and others at risk for falling asleep behind the wheel with little or no warning. Sleepiness contributes to 1 million crashes each year, and the best prevention is to get a good night's sleep the night before your trip. Boredom makes you feel sleepy even if you had enough sleep. This is very common. People are awake when they're active, but when they take a break or feel bored, they may notice that they are sleepy. What causes daytime sleepiness most is sleep loss, not getting an adequate amount of sleep at night. People who don't get enough sleep at night will fall asleep when they're bored. Boredom, like sitting in a warm, dark room, don't cause the drowsiness. It merely unmasks the drowsiness. If you're having daytime sleepiness, even after you've had 8 hours of sleep, an underlying condition or a sleep disorder should be considered. Finally, the last myth is obesity, diabetes, hypertension, and depression are unrelated to the amount and quality of a person's sleep. More and more scientific studies are showing correlations between poor and insufficient sleep and disease. There is a relationship between the quantity and quality of sleep you get at night and many health problems. For example, insufficient sleep affects growth hormone secretion that is linked to obesity. As the amount of hormone secretion decreases, the chance for weight gain increases. Blood pressure usually falls during sleep. However, interrupted sleep can adversely affect this normal decline, leading to high blood pressure and cardiovascular problems. Research has also shown that insufficient sleep impairs the body's ability to use insulin, which can lead to diabetes. So I hope that part of the presentation helped dispel some of the myths that I certainly have heard, and you probably have heard as well. So I'd like to just go over a few tips for sleeping smart, which everybody can benefit from, even if you're a good sleeper. And you can use these to evaluate your own sleep habits. The first one is to establish a regular bed and awake time, even on your days off and on the weekends. Going to sleep and waking up at a consistent time helps you keep the internal biological clock running smoothly. Use an alarm and do not vary by more than 1 hour day to day. Avoid napping during the day, but if you absolutely need a nap, it should be for less than an hour and before 3 p.m. It's also helpful to have regular times for meals, medications, or other activities to help you keep on schedule. Your body likes to have it. The second tip is to avoid caffeine and alcohol within 6 hours of bedtime. Stimulants such as caffeine and nicotine reduce your ability to fall asleep and to get into deep sleep. Approximately 50% of the caffeine that you drink at 7 p.m. remains in your body until 11 p.m. Caffeine is also present in some medications, in certain foods and beverages. Alcohol is a depressant, and it may help you fall asleep initially, but it wears off, and then your sleep becomes fragmented. It can also aggravate snoring and sleep apnea. Regular exercise can help you fall asleep faster and sleep more soundly. It was just brought to my attention that the National Sleep Foundation 2013 Sleep in America poll, which they do periodically, showed that people who exercise said that they snoozed better than those that did not. The poll also showed that exercising close to bedtime or early in the morning did not seem to affect sleep quality, which is opposite of previous studies that showed that exercise late in the day was bad for sleep. Regardless of the timing of your exercise, the important thing is that you exercise. Establishing a relaxing pre-sleep ritual can help make it easier to fall asleep. This can include a warm bath, a light snack, or a few minutes of reading. You should also give yourself some wind down time before you go to bed and let go of some of the anxieties before you get into bed so that your mind is shut down and it's not thinking over and over about these anxieties. And then the last tip is about the sleep environment. This is very important in this day of technology. Adjusting the temperature, using room darkening shades, and minimize noise. As I mentioned before, keeping the clock face turned away because watching the clock makes it impossible to sleep. Sleep medication for sleep difficulties can be considered once healthy sleep behaviors are being practiced. This concludes my presentation, and thanks for listening to this webinar on sleep. I guess we can take questions.
Great, thank you, Sue. This is some great information. I learned a lot. And sleep is something that we don't talk about because, or not enough, if we don't experience any issues with our sleep, but I think that it's safe to say that we've all experienced drowsiness or sleepiness at one point or another, or know someone in our life who is being impacted by poor sleep quality or a sleep disorder. So it's a great thing to talk about and to bring to light and hopefully help some people who have some questions regarding sleep. So this would be a great time if there are any questions for Sue to use the chat box feature on your screen there, and I'd be more than happy to share those with Sue, and I do see that we do have some questions coming in already, so we'll just go ahead and we'll get started with those. There's one here that says, how often do I have to experience insomnia before I need to discuss it with the doctor. So how do I know this is a chronic condition or something that I basically should just deal with until I'm feeling a little better?
Mm-hmm. Yeah, when I had discussed that earlier, if it occurs more than a few times a week and it's impacting your daytime functioning, so you're not waking up refreshed, you're falling asleep during the day, the symptoms should be discussed with the healthcare provider, because the sooner you treat it, the more responsive it's going to be.
Great. So I think listening to your body is key here, and if you're not liking it, time to do something about it.
Exactly. Yeah, and there's the behaviors, the tips work for that, and sometimes medications have to be added, but we have to be careful. But there are some good sleep medications, and sometimes if we get you back on track and get your rhythm back, the symptoms will resolve on their own. So the sooner the better.
Good. And it's nice to know that there are options.
Mm-hmm.
You know, however many years ago, people would just deal with it, but there are a lot of great solutions there to help you living your life better and healthier and more well. Another question we have is, why do they say you should not have screen time, like TV or computer, before bedtime? Does it really interfere with your sleep?
Again, that's the light. Light is probably the main thing that keeps us awake. When we wake up in the morning, the brain sees light, and we wake up. And that's why we are awake during the day and sleep at night. It's because of the light. So yes, light before bedtime, light in your bedroom at night can lighten your sleep and disrupt your sleep. Again, having a ritual away from the screen, taking some time to forget about what you were doing, online or in front of the computer, just to wind down and to get to bed in a dark room. But yeah, light is probably the biggest stimulator for your brain to be awake.
I think that's important to remember too when we want to take these daytime naps. Sometimes we just go plunk ourselves into bed and hopefully fall asleep, but we're left tossing and turning 20 minutes later. So make sure you pull the blinds and if you have something to cover your eyes, that would be very beneficial, it sounds like. The last question of the day is one that I too am curious about, and that is, why do some babies sleep through the night while others do not? Is this purely related to hormones, or is it a habit that is forming?
It's probably, it's genetic for one thing. Your sleep pattern is determined at birth. So your need for sleep or lack of sleep is pretty apparent right away. So when I see people in the clinic who sleep 10 hours, they will say, well, I was a good sleeper. My mother said I slept 10 hours as a child. So you can get an idea by asking, how you were as a baby. But environmental is also part of it. You can put a good sleeper in a bad environment and change their their ability to sleep pretty quickly. So, again, we do sleep studies on babies, mostly for sleep apnea, but I think if you feel that your child is not sleeping as well as they should, because kids don't necessarily get sleepy like adults. Kids actually get more active during the day if they're sleepy, which is just the opposite. So again, you should probably talk to your provider if you think. They actually, children or babies get a lot more deep sleep than adults. So that lessens over time. So they should be sleeping whatever the research says babies should be sleeping, but yeah.
Still interesting to know that it's genetic, so now we blame the other side of the family anyway, right?
Exactly.
So great.
Yeah.
This was really great information, and I'll be taking some of those topics that you spoke to heart, and I hope we all can take away something. from today's presentation. I'd like to thank Sue for being here with us today. We definitely appreciate it, and I know that, like I said before, we can all benefit from your information in some way, somehow, or at least share it with some people in our life who may as well. And Sue has been gracious enough to be able to take questions after today's webinar if you have any as well. More generally related, not specific to diagnosis, of course. But if you do have concerns, please contact your primary care provider and seek some help. There are some great resources out there for you, and that's important to not lose sight or forget about that. There's always someone out there that can help you get better sleep and more rest so that you can enjoy your days even more. So with that, again, I'd like to thank Sue, and so thank you for being here today, and we look forward to seeing everybody else on our next wellness webinar. Please take a few moments to complete the evaluation shortly after today's webinar as well, and we look forward to hearing your comments and what you think. So with that, I hope you all have a wonderful Independence Day, and I hope that those fireworks aren't keeping you up too late, but you can enjoy some restful sleep during your vacation time. Thank you all, and we look forward to seeing you next month.